Hey guys, I'm Dr. Eric, for those of you who haven't met. This is my favorite thing that I get to do today because I actually get to show you how to get well, not just get out of back pain or get rid of your migraines, but actually be well. That's what we want for you. We want you to be the healthiest version of you that you've ever been. I wrote a book a few years ago called Cruise Ship or Nursing Home. We actually sold about 250,000 copies of the book, so that was a really cool thing to see. But the reason I called it Cruise Ship or Nursing Home is because I always used to ask my patients, where do you want to end up when you're 80 years old, on the cruise ship or the nursing home? And what does everybody say? Cruise ship, right? Everybody wants to end up on the cruise ship. The problem is, where do most people actually end up in our country? In the nursing home. If you look at all the memory care nursing homes that are opening up around our office, it's like so many people have Alzheimer's disease, and the majority of the people that end up in the nursing home ended up there based on lifestyle. It wasn't their genes, it was their lifestyle. And you'll see when I talk about in a few minutes, the diseases that put them there were largely preventable. So it's my job is to help you end up on this cruise ship, and that's what we're going to do in the next few minutes, and then we're going to get you your rehab going as well, so you know what you're doing so you hold the adjustments in between, and you're going to see great results with that. So the reason that I think people actually end up here rather than end up here is because we're making a big mistake with our health, and this is the mistake that you can't make, because if you want to end up somewhere else, you don't want to end up in the nursing home, you want to end up on the cruise ship, that means that you need to do things differently than the people around you. Does that make sense? Like a lot differently in our country. And it starts with how you view your health. So this is a illness wellness continuum, and we call this crisis care versus health care. And the biggest mistake I think people make is they think that what we have in our country is health care. But it's not health care, it's actually what we call sick care. Because you have to be sick before you actually use it. You wait until you're sick, then you go to the doctor, right? So this illness wellness continuum over here this is 100% high level health over here. This is premature death over here, 0. And if you're born here and everything's functioning great, which you are, what people do is they just don't really think about their health much until they slide over here. And then when they finally do, by the time you actually start to feel symptoms, you're already down at a 3 or a 4. You're not feeling symptoms when you're a 7 or an 8. If you think like heart disease, people have a heart attack after they've had blocked arteries for 20 years, right? So they're not feeling it right away. They don't feel it until it's way over here. So this is our healthcare system, or our sick care system, is you wait until you feel bad, then you go to where? Where do you go? The doctor. And so the doctor gives you what at that point? You'll walk out with a prescription for something, right? And if that drug doesn't work, then they'll give you another drug, and if that doesn't work, then usually we'll do surgery. So it's like drugs, and surgery. Now the thing is, I'm not anti-drug or anti-doctor. When I broke my arm a few years ago mountain biking, I didn't want a chiropractic adjustment. I didn't want essential oils or something like that. I wanted him to do his thing in an emergency situation. The problem is that emergency way of thinking, which is go to the doctor, take medications, or let the doctor do their thing, that doesn't create health. And I'll prove it to you. So if you have high blood pressure, you develop high blood pressure, you go to the doctor, they take your blood pressure and it's high, and they give you a medication, right? So they give you like lisinopril or something. What happens when we put you on the drug? Your blood pressure goes what? Down. It goes down. Now the problem is, if I take that drug away, what happens to your blood pressure? It comes right back up. So we didn't fix anything. Do you understand what I'm saying? We didn't fix anything. All we did was put a piece of duct tape over the oil light in your car. And if you keep driving the car with the duct tape over the oil light, what's going to happen to your car? It's going to blow up. So can you see how we're ignoring symptoms and just treating effects, and then here comes heart disease, cancer, diabetes, the bigger things that you have to worry about, because what happens when you take that medication is it doesn't get you back over here. You just keep sliding this way. So our job is to do something different, which is look at the cause of the problem. Like, why do you have high blood pressure? Why do you have migraine headaches? Why do you have fill in the blank, IBS or any type of digestive problem or sleep issues? And we want to start correcting that. So instead of just waiting until you're sick, what we want to have you start doing is A, find the cause, but then B, start building health every single day. Rather than just fighting disease, we want you to be building health. And that's the way your health works, is every single day you're getting more and more sick or more and more well. There's no static wellness there. So we want you building health and being proactive. And that's what we do in here. That's real health care. That's not crisis care or sick care. That's real health care, which is the reason I don't go to, I'll go to a doctor if I'm bleeding on my eyeballs or something like that. But otherwise, I don't go to the doctor all the time to make me well, because that's not going to happen. I'm going to go there because like, raise your hand if you want to be on more drugs and have more surgery in your life. Anybody? Nobody wants that, right? So what I do is I'm building health every single day, so I don't have to worry about, my doctor telling me I need to be on these 14 different drugs, because I'm building health. Does that make sense? And that's what we want you to do. So with what we're doing with you is we're going to be building health this way, so you end up over here, right, which is constant, your nutrition's good, your exercise is good, you're making sure that you're doing things different than most people are doing. So that leads me to the next thing, which is what I call the fallacy of feeling good. And the reason that we don't do anything, for the reason most people don't do anything about their health over here, is because they feel what? They feel pretty good, right? So the fallacy of feeling good is like the leading causes of death in the United States. I'm going to show you what symptoms those have, okay? So the third leading cause of death in the U.S. is cancer. 650,000 people a year die of cancer in our country. Now, what's the early symptom of cancer? When you're developing cancer, what do you feel? Nothing. Did you know you have to have at least 6 billion cells in a tumor before they can detect it on a mammogram? Did you know that? So they call that early detection. That's not early detection. That's 6 billion cells, right, when you go get a mammogram. So we think that is prevention, but even that's sick care, right? That's waiting until you're sick, or that's picking something up when you already what? When you already have it, right? What we want to be doing is not early prevention or early detection of cancer. We want to be preventing cancer, which you can do. Cancer is 90% related to lifestyle. Did you guys know that? 90% related to lifestyle. And the cool thing is, if you have quote unquote bad genes, the science shows now you can turn those genes on or off based on your lifestyle, right? So you can't wait until you feel cancer to do something about it, right? Same thing with heart disease. Heart disease kills 720,000 people a year. Early symptom of heart disease would be what? There isn't one. Even if you think like high blood pressure is not an early sign. It's the inflammation in your arteries has been there for years by the time your blood pressure goes up. My uncle had a heart attack when he was, I think, 47 years old, and he had a 99% blocked artery in all 4 arteries in his heart. And how do you think he felt the day before he had the heart attack? Fine. So he felt great with 98% blockage in his arteries, and then had a heart attack the next day. So again, you can't base your health on how you feel. So if you're here and you're already feeling bad, you're already experiencing symptoms, you're already having these symptoms or have had them for a while, that means you've been sliding this way for a while, and we got to start moving you this way, okay? Now, the leading cause of death, and this is what a lot of people don't know, this might be the most important thing you learn all day today, is the leading cause of death and injury in the United States is not heart disease or cancer. It's what's called iatrogenic death. You know what that means? Iatrogenic is a Latin word for treatment-induced death. This is a book by Gary Null. It was written by 3 medical doctors and 4 PhDs, and it's called Death by Medicine. Okay? There's 357 peer-reviewed studies in here where they get all the numbers for, and they say the leading cause of death and injury in the United States is not heart disease. It's going to the what? Doctor. Now, it's not that the doctors that are evil and trying to kill you. The problem is we are 5% of the world's population in our country, and we take 70%, almost 70% of the world's drugs. Think about that for a second. 5% of the world's population, almost 70% of the world's drugs. Well, how's that working out for us? It's not. We lead the whole world in Alzheimer's disease, high blood pressure, diabetes, obesity. We have more sickness and disease and degenerative illness than any other country in the history of the planet, right? So when we go to like what iatrogenic death actually means, when you add those things up, it's correctly prescribed medication, incorrectly prescribed medication, hospital medical errors like in the hospital, malnutrition in nursing homes kills 780,000 people a year from going to the doctor, which is again, just being in this system that I was talking about, being over here. So if we can get you building health and staying out of this orange and yellow area over here, we can get you preventing heart disease, which is again 95% preventable. We can get you preventing cancer, which is again 90% preventable. Whatever you're gonna die of, I don't know what that is, but you're gonna end up on the cruise ship, all right? And that's our job, okay? So instead of you're basing your health on how you feel, what we want to make sure we're basing your health on is how you function. Because function is something you can take to the bank. Feeling, you don't feel bad when you have cancer at the beginning, but function is a different thing. If you're functioning well, you can trust in that. And what controls function in your body? You remember from the x-rays? Your brain and your spinal cord control all function and healing in your body. Now here's something to understand. This is not my theory. This is not chi or energy flow or something like that. This is your brain has, the first thing that forms inside of your body is your brain and spinal cord. I don't know if you know that so what we're working on when we're adjusting you is called innate intelligence. It just means you were born with a certain intelligence inside of your body. And that intelligence was already in the cells, the first 2 cells that formed you. Those 2 cells from your parents came together, and then they started dividing and dividing and dividing. And the first thing that forms is your brain and your spinal cord. It's called the neural tube. Very first thing that forms in the first 8 to 10 days of life. And then everything else, all the nerves grow off of that, and that's where you get things like kidneys and a heart and lungs and fingernails and toenails and eyeballs and things like that. That innate intelligence knew how to take you from 2 cells to 70 trillion cells by the time you're born. Think about that for a second. 2 cells to 70 trillion cells by the time you were born. That power did not leave you when you were born. It's still on the job. You get a new stomach lining every 12 hours. You get a new lung lining every 24 hours. I mean, that power is healing you every single second of every single day, and most of us take that for granted, right? So here's the understanding about this innate intelligence. If that innate intelligence is inside of you, so let's take an example like you cut yourself shaving this morning. So let's say you cut your leg shaving and we put a piece of toilet paper on there. What happened to the cut on your leg? After a couple hours, it healed, right? You didn't have to think about it, pray about it, go to the doctor for it. It healed on its own. So if it can heal that cut on your leg, why can't it heal your migraine headaches that you came in for, or your digestive problems, or your sleep issues? Think about that for a second. If it can heal the cut on your leg, why can't it heal that? Because no doctor on planet Earth can heal the cut on your leg. Only your body can do that. And the answer is it can heal whatever you came in here for. The reason it's not is because something's interfering. Does that make sense? Something's interfering with that ability, your body's ability to heal, and what we're doing is removing that interference. So this is a good way to explain it. It's called the safety pin cycle. So if you've ever seen a safety pin, your body's actually like that. Your brain is talking to your body, and your body's talking back to your brain. So your brain is sending a message to, say, your stomach down here and say, hey, is everything going okay down there? And the stomach's like, we actually need some more stomach acid down here to digest this food. And the brain says, okay, I'll send more stomach acid down there, right? How is everything now? Okay, we need less stomach acid now. That's the way it works. But over here, if you have a subluxation, or if there's any interference between the brain and the body, the brain's saying, hey, how's everything going down here? And the body's not talking back, so the brain's like, must need more stomach acid. So it's pumping more stomach acid down there, and it doesn't get this feedback loop to turn it off. What disease would that be called when you have too much stomach acid? That's acid reflux, if you've ever heard of that, or heartburn, right? So our job, instead of giving you Prilosec and Nexium, which don't close that loop, our job is to close that loop so your brain and your body can do what they're designed to do, okay? And that's what you're doing every single time you get adjusted. So what we're correcting in there is what's called a subluxation. And a subluxation is when the bones get shifted out of position, or if you lose the normal curvature or function in the spine, and it compresses those nerves, and what that's gonna do is stop the brain and the body from talking to each other the way they're supposed to. So when we're adjusting you, we're not popping your neck, we're not popping your back, we're not trying to get more range of motion and more mobility. We're working with that innate intelligence inside of your body. So here's what's actually going on every single time you lay on the tables and get adjusted, okay? So the first thing that happens, your cerebral spinal fluid flows better, which means it's draining waste products out of your brain. The waste products that build up in your brain overnight are called beta amyloid proteins, and they drain out through normal motion of your spine. If you don't have normal motion of your spine, you don't get that CSF draining the waste products out of your brain. And that's where Alzheimer's comes from. So that's why we don't get Alzheimer's around here. When you get adjusted, your brain's working better. Your CD4 and your T cells are working 40% better for the next 48 hours after you get adjusted. They did a study of people that had HIV, and they put people in a group over here that had HIV, and this group had HIV, this group got adjusted, and this group didn't. This group saw their CD4 cells go up 48% compared to these people. That's how much better your immune system is functioning. So you'll see people that have been getting adjusted for a long time, they just don't get sick anymore. Or if they'll get like a scratchy sore throat and it's gone where it would have been 2 weeks before, or something like the flu. So your immune system functions better. Your discs are rehydrated, so you actually stop shrinking. If you saw any degeneration on your x-rays, and we talked about degeneration or degenerated discs, that means if we did an MRI of you, it would say big disc bulge. I don't need an MRI to tell you that. I can see it on the x-ray. But when you get adjusted, the discs are rehydrating, and we can actually repair a lot of the disc damage that's gone on. So not only does it never get worse, it actually can get better over time. Serum thiol levels increase. This is a marker of DNA repair inside of your body, which means you're younger every single time you get adjusted. Your body is repairing damage to the DNA. That's incredible. That's what's happening every time you get adjusted. Your blood pressure decreases. There's a great study in Journal of Hypertension magazine, and they looked at 2 groups of people again. This group over here had high blood pressure. Both of them did. This group took 2 different drugs, HCTZ and lisinopril. This group got adjusted because the part of your body that controls blood pressure is right here. So these people got an upper cervical adjustment. They lowered their blood pressure more than the people on the drugs with 0 side effects. That's why we see so many people get off of blood pressure medication, because they just don't need them anymore. So that's happening every time I adjust you. So 2 things to understand about that. Number 1 is it doesn't take me longer than that long to adjust you to have those things happen. Right? So we don't need to do, massage and all these different contraptions and things like that, because I'm not healing you. Who's healing you? You are. All we're doing is removing the interference. So it doesn't take a long time for that adjustment to work, and you're actually healing in between the adjustment. The second thing, though, is if like I have my hands on your brain stem, right? I have my hands on the one thing that controls all health and healing in your body. Do you see why we're not talking about the Broncos or about the weather or about anything? I'm not focused on anything other than giving you that adjustment and letting that innate intelligence heal the way it was designed to heal. So when you come in the office, that's why I'm not talking a lot, or Dr. we're not talking a lot back in the room. What we're doing is focused very clearly on adjusting. If you ever need help with anything else, that's where we do the workshops, and that's where you can do a consultation with us. We can do phone consultations, any of that. But when we're adjusting you, we're working with that innate intelligence right there. Okay, so this is how you heal. So just going to wrap it up with this. There's 3 things that we ask for you to heal in this office. So in order for you to be a patient and get the results that you want, 3 things that we ask you to do. The first thing is put the time in, okay? Which means do your adjustments, do your rehab. Okay, those are the first 2 things. Put the time in. Because if you don't put the time in to fix the problem, what happens to the problem? It just gets what? Worse. And how much worse does it have to get? So let's put the time in and actually fix the thing, right? So that means making all your adjustments, doing all of your rehab, which we're going to give you in a minute. One of those is the dinner roll. We're going to explain exactly how these work and what you're going to be doing on a daily basis, because every time we adjust you, we're correcting things, and you need to help keep it corrected at home because we're changing soft tissue, and we're going to show you how to do that. And then the second thing we ask you to do in terms of time, though, putting the time in is the adjustments and the rehab, but the second part of putting the time in is getting to the workshops that we do. These are included in your care plan. I don't make $1 off these workshops. I do this because you need to know what it takes to actually be healthy and well in our country. So I'll give you an example. This is Jim and Judy. Jim and Judy are in the cruise ship book. Their testimonials in there. And I met Judy, this is years ago now, but when she came in, between the 2 of them, they were on Zocor, which is high cholesterol medication. They were on sleeping pills. They both had CPAP machines for sleep apnea, Flonase for allergies, both on blood pressure medications. Jim had COPD, which means he couldn't breathe. So he was on about 4 different medications for that, diabetic, and acid reflux. So they were on about 27 different medications combined. Okay, so my job wasn't to get rid of her headaches and to get rid of his low back pain. My job is to get them off of that stuff so they can end up on the cruise ship where they're supposed to. So what did they do? The first thing they did was maximize mind. We work with what's called the 5 essentials. So how do we get your body working right? One of them is get your mind working right. And what that meant was they just understood that they didn't have to be on those drugs the rest of their life if they didn't want to. That they could take control of their health and start making different lifestyle choices and didn't have to just accept that they're going to be on those drugs forever. So if your doctor ever told you you're going to have to be on that drug, that blood pressure medication the rest of your life, the only thing that you have to do to prove the doctor right is just listen to them, right? But I see people all the time get off of those drugs. Now, I don't put anybody on them or get anybody off, but we see people get rid of the need for those medications. So that was the first thing, is I said, okay, I'm going to take control of this. They did spinal correction. So his pre and post x-rays, this is Jim's pre and post x-rays. He had a 14-degree curve here. That curve is now up to 40 degrees 90 days after he started. That arc of life is functioning better. The brain and the body are communicating. His blood pressure went down almost immediately. His acid reflux was gone. Both of those medications in the trash can. But then they came to the workshops that we teach. So I remember talking to her. I said, we're going to be doing a nutrition workshop. We do this about every 6 to 8 weeks. So one thing that we want for you as a patient is we want you to come to at least one of those during your corrective care. And I remember her talking, and she's like, no, I eat really well. I said, cool, bring me the list of what you've been eating and bring me a couple of things in your pantry. And I showed her the food label right there. And I was like, do you realize this is another name for MSG that's killing your brain cells? This is causing you to stay up late at night and not be able to sleep, is because of what they're putting in here. There's about 15 different things. And she's like, I had no idea. Right? So just trust me on this. I've been doing this for over 20 years. You don't know what you don't know. So we teach you how to simplify nutrition, how to simplify detox. They did what's called the 20 and 30 plan. They lost 20 pounds in 30 days. You have access to that same 20 and 30 plan with all the meal plans, all the recipes, and everything that you need to actually get well. Long story short, they're off all of those medications. They both lost almost 40 pounds, and they're the healthiest people that you've ever seen on planet Earth compared to where they were headed before. Okay, so it's really simple. Get to one of those workshops, and Jim and Judy, actually, Judy has probably been to 50 of these workshops, because every single time they come around, she's like, I know I need to learn a little bit different, a little bit more, a little bit more, a little bit more, lifelong learning. The second thing that we ask, other than putting in the time, is if you have family, you get them checked. And the reason we ask you that is because the only way to know if you're healthy or if you have a subluxation is by getting an x-ray. So the way subluxations happen inside of your body is like car accidents, sports injuries, kids sitting on computers all day long. That's what damages the spine and causes those subluxations. And how do you think you feel when you have a subluxation for most of those? You don't feel what? You don't feel anything. right? So this is another huge problem with kids right now. It's called text neck or technology neck, because we do this all day long on our phones and on tablets and on computers, and you can lose that curve in your neck immediately. And what happens when your head shifts forward, it puts 27 pounds of pressure on your neck. Now, what is the spinal cord in your neck? What does that control in your body? Everything, right? If you're shifted forward another few degrees, that's 40 pounds of pressure on the neck. And there's no way to correct that, or no way to know what's happening other than getting an x-ray, right? So if you're a patient and you have family, we just ask you to get them checked. This is an example of why I do that. This is Elise. When she first came in, she had scoliosis. So she's 4 years old. Instead of her spine being straight up and down, it's curved to the side. So her dad had scoliosis. I'm like, we need to get your daughter checked. She didn't have any symptoms. She didn't have back pain. She's 4, right? So we got her checked, and what does she have already? Scoliosis. Scoliosis is a progressive disease that gets worse if you don't correct it. So this would have gotten nothing but worse, but instead, this is her x-ray after 60 days, what do you see there now? Straight up and down, no scoliosis. Scoliosis is completely gone at that point. So that her whole life is radically transformed now, like no surgery moving forward, no braces, no any of that stuff. And it took 60 days and hardly any money to correct it. So if you have a kid that may have scoliosis, when would you want to fix it? Now, or when they're looking at $100,000 surgery? Now, right? It's very simple, and you do that by getting an x-ray. So the reason that I ask that everybody does this, and again, I want you to hear my heart on this. It's not my way or the highway. It's that I literally can't see a family and have their kid knowing that they could be developing scoliosis without me doing something about it, or at least giving them a chance to. So this is a little girl that I used to take care of. Actually, I took care of her mom. So when I first got out of school, started practice, and mom had scoliosis on x-ray, and I said, hey, we need to get your daughter checked. She was about 5 or 6. And the mom said, well, I talked to my husband, and we don't really have the time, and we don't really have the money, and we're busy, right? And I didn't really push it. I should have, because mom had scoliosis. A lot of times that means the daughter has scoliosis too. But I didn't, and I took care of mom, and she ended up getting better, and she did great, and she moved to Florida. And then about 10 years later, I remember the name. It was scheduled as a new patient, and I remembered her name, and I walked in there, and the mom was standing over here, and the daughter was now 15, 16 years old, and the mom just went over and picked up the back of the daughter's shirt and lifted it up, and I saw these 2 scars from the base of her neck all the way down to her butt, where they had done scoliosis surgery. And she slipped one day coming down the stairs. The rods broke. They had to pull the rods out and pack them together with bone chips. So now she lives on oxycodone at the age of 15. I couldn't even touch her back. She was in such pain. And I remember the mom looked at me and she said, why didn't you tell me it was this important when she was 5? And I will never forget that. I also never let that happen again. So if you're a patient in here, we at least ask you, get your family checked. No one has to start care. We pay for the x-rays, right? So, and the other thing is I've never turned anybody away for finances ever, but we at least ask you get them checked, because the only way you tell is by getting an x-ray. And then the last thing that we ask is that you tell other people what you know. And the reason for that is not because we need new patients. I've seen plenty of new patients over my career. The reason we ask is that people around you need to know what you know. They don't know. They're stuck on medications. They're stuck being told they have to live with it the rest of their life. This is a great example. This kid's name is Sterling. Sterling, when he first came in, he was having seizures and migraines, like horrible epileptic seizures, migraine headaches. They had put him on Depakote, Tegretol, and 3,200 milligrams of ibuprofen a day. This is a 10-year-old kid on 3,200 milligrams, which is like 3 times an adult dose, which was destroying his stomach, destroying his kidneys. And he came in here after he had had the seizures for a while. And long story short, he had fallen off of a sheep. They were doing mutton busting. You guys ever heard of that before? So he fell off of a sheep, and the sheep kind of kicked him and hurt his neck. But they went and got an MRI. They didn't find anything. But then he starts having migraines and starts having seizures. So where do they go? Children's Hospital, neurologist, put him on all these different medications. They can't stop the seizures. And what their life looks like is Sterling is sleeping in between Carrie and Frank, the mom and dad, because they're scared he's going to seize in the middle of the night and swallow his tongue and die. Right? So they haven't had a night alone in like 9 months. And what happened a few times a week is he would start seizing, and they'd have to pick him up. Frank would carry him downstairs, put him in the back of the car, and they would drive to the hospital. They live out in Bennett, so it's a little while to the hospital. And Frank would be in the back holding his mouth open saying, please don't die, please don't die, please don't die, please don't die, on the way to the hospital. This is a weekly occurrence. They stop the seizures, don't know what to do about it, send him back home. So one of our patients named Charlie heard me talk about how chiropractic can help seizures, and we've seen people get better with seizures. So Charlie one day goes to his boss, Frank, who's the dad of Sterling, and says, hey, you need to go see if my chiropractic can help you. And what do you think he said? I ain't doing that. I've been to Children's Hospital. I've been everywhere. What's chiropractic going to do? So he didn't do it. And then he doesn't give up though. So like 20 more times he says, go see if my chiropractic can help Sterling. Go see if my chiropractic can help Sterling. Come to this workshop with me. Go see it, go see it, go see it. Finally, after like 19 times, Frank Lane says, fine, I'll do it. Because they had been to the doctor again, and the doctor said there's nothing to do, right? So he finally comes in here. We take an x-ray of him. The top bone in his neck that should be pointed up is angled down, which is why he's getting these seizures. Laid him on the table, adjusted him, and his dad's like, what happened? I said, he's gonna get better. Called him that night. He didn't have one seizure the rest of the night. He has not had one seizure or one migraine headache after that one adjustment. So what was the solution to the hell that they were going through? One adjustment. And you know who the hero is in that story? It ain't me, it's Charlie. It's the guy who didn't give up on him, right? So who do you know that's out there that needs help, that is sick and suffering? And the thing is, I don't care if they're in Florida, Texas, California. This is not about our practice. I'll find them help that they need if you have family members. But if there's somebody around here, I tell them what you know. Because if we're out to dinner or something and we're friends, and you know that this place could help my son with seizures, if he had seizures, like how much would you have to hate me to not tell me that? You know, I'm not asking you to like do anything other than just tell them what you know, and we'll get them the help that they need. So that's really it. It's just put the time in, you know, get your family check, we pay for that, and then just tell other people what you know, and we'll help you do that any way we can. We do a thing called Dinner with the Doc. We do patient appreciation days. We try to make it a lot of fun because people really need your help. So looking forward to seeing you get well. We're gonna get you started on the rehab in just a minute. If you have any questions, let us know, and we'll get you rolling.